Another type of reflexes which could be seen during neurological examination is the superficial reflexes. Alright? So superficial reflexes. When they say something is superficial, you simply know that the thing is at the up. It's not a deep reflex. It's not a tendon reflex. It's a superficial reflex. So it actually has to do with the skin. You understand? So we get to look at the superficial reflex. We'll define the whole concept and talk about the different types of what superficial reflexes that we have. So for the definition, we said that what a superficial reflex is a motor response that occurs when the skin is gently stroked or scratched. All right. So when you gently stroke the skin, this way you want to elicit what Babinski sign. Do you understand? And sometimes you might even just be, you understand, just be touching like this, okay, but because you want to elicit some reflex. So what are the different types? First of all, on the list we have what Cremaster reflex, right? I would say that this one is a reflex in males that causes the cremaster muscle to contract and pull the testicles up towards the inguinal canal when the inner thigh is stroked. Okay, so let me just take a picture of these different types of reflex. Probably I might do videos on all of them. All right, then we have the giggle reflex. This one is a female reflex that what involves contraction of the muscle fibers along the upper part of the inguinal ligaments. Okay, then we have the plantar reflex. This one is a common superficial reflex. Plantar, the toes, under the toes, right? Abdominal reflex, I brought the image here. Then we have the anal wink. This one is also a superficial reflex, right? So these superficial reflex are important clinically because they depend on the functional upper motor pathways and spinal cord level reflex arcs, okay? So this superficial reflex now, we say that they are elicited by stroking the skin at various sites to produce specific muscle contraction, all right? And the best known sites are the abdominal, which are basically what stimulating the T7 to T12, and the cremasteric, which are stimulating what L1 and L2, and the anal one, which is basically what S4 and S5 reflex, right? So these are what corticospinal, that's upper motor neuron reflexes. So absence of the reflex indicates that there is a lesion in the upper motor neuron network, okay, which is usually what in the spinal cord, right, above that level, right? So I think that's it for the superficial reflexes during neurological examination, the definition, the types, and elicitation.